Hello, welcome to Anatomy DAHAR series. Today's topic is the scapula, the diagram-based upper limb lecture. It includes practice questions and practical quiz at the end. Text slides are from 2nd to 30. Questions and practical quiz are from slide number 32 to 36. Color code of the text. The basic anatomy must know in light yellow color. Clinical highlights good to know in light red color. Find points for the advanced readers in bold print and light blue in color. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Scapula. In plural, scapulae. Each pectoral girdle is made up of two bones, clavicle in front and scapula behind. Look at the diagram. This is posterior view of thoracic cage. This is right pectoral girdle, left pectoral girdle. In front is clavicle, behind is scapula. Scapula is also known as shoulder blade. Each is located at the upper posterolateral aspect of the thoracic cage. Upper and posterolateral aspect of the thoracic cage. It extends from the levels of second ribs above to the seventh rib below. However, the scapula is not attached to the ribs. Each scapula is attached to the lateral end of the clavicle and head of the humerus of respective side. Scapula continuation. The scapula is a flat bone of triangular in shape. Hence, it consists of two surfaces, three borders, and three angles. It also possesses three processes and four fossae. Let's see the diagram. This is the lateral view of the right scapula. This is anterior, so this will be posterior. This is anterior surface, also known as ventral surface, and this is posterior surface, also known as dorsal surface. Let's talk about surfaces of the scapula. The scapular flat bone consists of two surfaces, ventral, that is anterior, and dorsal, that is posterior surfaces. Let's go the ventral anterior surface. It is related to the ribs, costae of the thoracic cage in front. Therefore, the ventral or anterior surface is also known as costal surface. Ventral surface of the scapula continuation. Look at the diagram. This is the ventral surface of the right scapula. That is anterior surface of the right scapula. Number 1. Ventral surface of the scapula is concave, shallow depression called subscapular fossa. Red dotted area surrounded by red dotted area. This is subscapular fossa. Sub means deep or under, fossa means shallow depressed area. Few ridges are present. These are the ridges. Few ridges are present in the subscapular fossa. They give attachment of intermuscular septa. Now, second surface is the dorsal posterior surface of the scapula, which face behind. It is convex posterior. Look at the diagram. This is anterior, this is posterior. So this is posterior or dorsal surface, which is convex. The dorsal surface of the scapula is divided transversely by a spine of the scapula into two fossae, the one above and the one below the spine. The fossa above the spine is the supraspinous fossa, and the fossa below the spine is called infraspinous fossa. So this is supraspinous fossa and this is infraspinous fossa on the dorsal surface of the scapula. Supra means above and infra means below. That means one is above the spine and another one is below the spine. This is the posterior view, that is looking from behind to the dorsal surface of the scapula. You can see here, this is the dorsal surface of the scapula. It is divided transversely by spine of the scapula. In this diagram, you can see two fossae on the dorsal surface of the scapula with red dotted lines. The one above the spine is supraspinous fossa, which is smaller, and the one below the spine is infraspinous fossa below the spine. It is larger. This is smaller. The triangular body of the scapula is thin and translucent. Infraspinous fossa shows few ridges which give attachment of the intermuscular septa from here, this infraspinous fossa. The spine of the scapula. Look at the diagram. This is the dorsal surface of the scapula looking from behind. This is the spine of the scapula, dark blue color. This is the spine of the scapula. The spine of the scapula is triangular in shape, horizontal plate projected posteriorly from the dorsal surface of the scapula. This dark blue color is the spine of the scapula, triangular in shape. It is at the level of 3rd to 4th thoracic vertebrae. The spine has three borders. Because it's a triangular shape, it has three borders: anterior border, lateral border, and posterior border. The anterior border. This is anterior border, red line. It is attached to the dorsal surface of the scapula. So the anterior border of the triangular shaped spine is attached to the dorsal surface of the scapula. The lateral border, this white line, is the lateral border. It is free and directed laterally. Next is the posterior border, this yellow line. This posterior border is thick and called crest of the spine. It is easily palpable. So, triangular shaped spine of the scapula. This is anterior border attached to the dorsal surface of the scapula. Lateral border free, directed laterally. Posterior border is forming the crest of the spine. It is directed posteriorly. We'll continue the crest of the spine. This is the crest of the spine. It has two lips, the upper or superior lip and the lower or inferior lip. It has a tubercle. tubercle of the spine of the scapula, which is about 3 to 4 centimeter from the medial border of the scapula. This is the tubercle of the spine of the scapula. Crest of the spine is extended laterally and formed broad and flat acromial process. This is green color is the acromial process, which is the lateral extension of crest of the spine. In Greek, acros means highest, almost means shoulder. That means acromial process is the highest point of the shoulder. It forms the tip of the shoulder, the uppermost point in measuring the upper limb. Look at the diagram. This is the anterior view of part of the scapula. This is lateral end of the clavicle. This is acromial process, that is the lateral extension of the crest of the scapula. The acromial process of the scapula is articulated to the lateral end of the clavicle. Together they form acromioclavicular joint. Acromioclavicular joint. This is the joint between the acromial process of the spine of the scapula and lateral end of the clavicle. Borders of the scapula. Look at the diagram. This is the anterior view of the right scapula, that is the costal surface or anterior surface. This is medial side, this is lateral side. Because scapula is triangular shape, so it consists of 3 borders. This is lateral border, this is medial border, and this is superior border. The lateral border is along the armpit, which is axilla, so it is also called the lateral border or axillary border. It is thick because of strong muscles are attached to it. This is medial border. Here is vertebral column, so medial border is also known as vertebral border. It is thin and long. Borders of the scapula, continuation. The superior border. This is the superior border of the scapula. It is thin and the shortest among the 3. The superior border consists of 2 structures. Number 1, this is the upward projection or process called the coracoid process. Greek words corax mean a crow. This one looks like beak of the crow, so that it is called coracoid process. This is medial side. Just medial to the coracoid process, there is a notch here. It is called suprascapular notch. That is above the upper part of the scapula. Suprascapular notch. Let's talk about the coracoid process. It is bent like a finger, consists of 2 parts. This is perpendicular part, P, and this is horizontal part, H. Lateral to the horizontal part, this is the tip of the coracoid process, also called apex. The tip of the coracoid process can be palpated from the infraclavicular fossa, which is located just below the clavicle. We are going to continue the superior border of the scapula and the structures in it, that is the coracoid process and suprascapular notch. Suprascapular notch is just medial to the root of the coracoid process. Suprascapular notch is bridged by suprascapular ligament and becomes changed to suprascapular foramen. So at first the notch, because of this ligament, this becomes suprascapular foramen. Suprascapular artery and vessels, that is, passes over the ligament, and suprascapular nerve will go through the foramen below the ligament. You can see very carefully, artery A, to remember, artery A, Air Force, nerve and Navy, always Air Force is over the Navy. Artery is over the nerve, separated by suprascapular ligament. Angles of the scapula. Look at the diagram, anterior view of the scapula. Scapula is a triangular shaped structure, so it consists of 3 angles. Look here. This is superior angle, inferior angle, and lateral angle. The superior angle is more or less right angle. It is at the level of second rib. The inferior angle is more or less acute angle. It is at the level of 7th rib. The lateral angle is not a true angle. It is broadened and formed a shallow oval-shaped socket called glenoid fossa. In Greek, socket is known as glenoid. So, lateral angle, where we have glenoid fossa, is also known as glenoid angle or head of the scapula. So, you can call this one is glenoid angle, lateral angle, as this is the head of the scapula. Just medial to the head of the scapula, this constricted part is called anatomical neck of the scapula. Glenoid cavity, also called glenoid fossa. We have 2 diagrams here, diagram A and diagram B. In diagram A, we are showing the glenoid cavity of the scapula, which articulates with the head of the humerus to form the shoulder joint. So here, head of the humerus will articulate with the glenoid cavity or glenoid fossa and form the shoulder joint. The glenoid cavity, the glenoid fossa, serves as primary socket of the shoulder joint. Then, what structures form the secondary socket of the shoulder joint? Look at the diagram B. Look at the structures first. We label structure. Number 1, this is coracoid process. Number 2, this is coracoacromial ligament. Coracoacromial ligament. And this is number 3, acromial process. So these structures, number 1, coracoid process, number 2, coracoacromial ligament, and number 3, acromial process, 3 of them formed an arch called coracoacromial arch. This is the one, coracoacromial arch. It is located above the shoulder joints and serves as secondary socket of the shoulder joint. It prevents upward dislocations of the shoulder joint. Continuations of the glenoid cavity, also called glenoid fossa. The diagram is the lateral view of the right scapula together with the glenoid cavity. Glenoid cavity is related to two tubercles. That is, one above the glenoid cavity is supraglenoid tubercles. This is the glenoid cavity. One tubercle above the glenoid cavity is supraglenoid tubercle. The one below the glenoid cavity is infraglenoid tubercles. What structures are attached to these tubercles? The supraglenoid tubercle is attached by long head of biceps. The infraglenoid tubercle is attached by long head of triceps. Biceps, triceps. We are looking at two diagrams of the dorsal surface of the scapula, diagram A and diagram B. This is spine of the scapula. Spine of the scapula divides the dorsal surface of the scapula into two fossae. Above the spine is supraspinous fossa. Below the spine is infraspinous fossa. Spine of the scapula is triangular in shape. We have already mentioned lateral border. This is the lateral border of the spine of the scapula. This is glenoid cavity or glenoid fossa. The gap between here, or the notch or passage between the spine of the scapula and glenoid cavity, is called spinoglenoid notch or spinoglenoid passage. What structures go through this spinoglenoid notch? Let's see the diagram B. This is the spinoglenoid notch. Is passed through by, descend through by suprascapular vessels and nerve. Muscles attached to the scapula. 18 muscles are attached to each scapula. Out of them, 3 muscles are attached to the anterior surface of the scapula. Number 1, subscapularis muscles. This is the subscapularis muscle. It is attached to medial 3/4 of the subscapular fossa. Number 2, serratus anterior muscle. It is attached along the medial border and anterior surface of the scapula, extending from superior angle to the inferior angle. Number 3, omohyoid, inferior belly of omohyoid muscle. Very small muscles. It is attached to the superior border and anterior surface of the scapula, just medial to the suprascapular notch. 8 muscles are attached to the posterior, that is dorsal surface of the scapula. The first one is supraspinatus muscle. This is the one, supraspinatus muscle, which is attached to the medial 2/3 of supraspinous fossa above the spine of the scapula. Next is teres minor muscle. This is the one which is attached to the upper 2/3 of the lateral border of posterior surface of the scapula. Next, muscles attached to the posterior surface of the scapula. Continuation. Infraspinatus muscle. This is the one. It is attached to the medial 2/3 of the infraspinous fossa. Next is teres major muscles. This is the one which is attached to the lower 2/3 of the lateral border of posterior surface of the scapula. Next is muscles attached to the medial border of the posterior surface of the scapula. This side is lateral border, this is medial border. That is levator scapulae muscles, which is attached from superior angle to the spine of the scapula along the medial border and posterior surface. Next is rhomboid minor muscle. This is rhomboid minor muscle, which is attached to the medial border at the level of spine of the scapula. This is rhomboid minor muscle attachment. This is levator scapular muscle attachment. Next is rhomboid major muscle. This is the one which is attached to the medial border and posterior surface of the scapula from the level of the spine to the inferior angle. The attachment is here. This is rhomboid major muscles. Next is latissimus dorsi muscle, which is attached not to the medial border but to the dorsal surface of the inferior angle of the scapula. Next group of muscles are those attached to the coracoid process and clinoid tubercles. Three muscles are attached to the coracoid process. They are pectoris minor muscles, which is attached to the medial border of the horizontal part of the coracoid process. Next is short head of biceps muscle, which is attached to the lateral part of the apex of the coracoid process. Next is coracobrachialis muscle, which is attached to the medial part of the apex of the coracoid process. Number 13 and number 14. Next is two muscles which are attached to the clinoid tubercles. They are number 15, long head of biceps, which is attached to the supraglenoid tubercle, and number 16 is long head of triceps, which is attached to the infraclinoid tubercle. Next group of muscles are muscles those attached to the acromial process and spine of the scapula. There are two muscles, the last two muscles, deltoid muscles and trapezius muscles. This is superior view of pectoral girdle. This is acromial process. This is crest of the spine of the scapula. This is lateral border of the acromial process. This is medial border of the acromial process. This is upper lip of the crest of the spine, and this is lower lip of the crest of the spine. Okay, now we talk about the deltoid muscles. It is attached to the lateral border of the acromion, and continuously it is coming down and attached to the lower lip of the crest of the spine. This is deltoid muscles attachment. The last muscle is trapezius muscle. It is attached to the medial border of the acromion, and continuous to it is the upper lip of the crest of the spine of the scapula. So outside circle is attached by the deltoid, inside circle is attached by the trapezius muscle. They are all 18 muscles attached to the scapula. Ligaments of the scapula. 7 ligaments attached to the scapula. They are named based on the site of the attachment. Number 1, coracohumeral ligament. That means between coracoid process and humerus. Number 1. Number 2, coracoacromial ligament. Coracoid process to the acromial process. Number 3, coracoclavicular ligament. The ligament between the coracoid process and inferior surface of the clavicle. Number 4, suprascapular ligaments. Here is the suprascapular notch. The ligament which is bridging the notch is the suprascapular ligament. In addition to them, 3 more ligaments are attached to the scapula. They are, you can see here, number 5, acromioclavicular ligament, here, attached between the acromial process and the clavicle, acromioclavicular ligament. Number 6, shoulder, that is here, shoulder joint here, glenohumeral ligament, glenoid fossa and humerus. Glenohumeral ligament, that's the capsule of the shoulder joint, also called Flood's ligament. And number 7, costocoracoid ligament of the clavipectoral fascia. It can be learned in the clavipectoral fascia in the pectoral region. Coracoclavicular ligament, number 3, prevents the dislocations of the acromioclavicular joint, number 5. Coracoacromial arch, we have already stated earlier. Let's see the diagram. This is lateral view of the shoulder joint. This is anterior, this is posterior. Number 1 is coracoid process. Number 2 is coracoacromial ligament. Number 3 is acromial process. Coracoacromial arch is made up of these 3 structures. They are coracoid process, coracoacromial ligament, and acromial process. Together they formed an arch called coracoacromial arch. The arch is located above the shoulder joint and serves as secondary socket of the joint. It prevents the upward dislocations of the shoulder joint. The arch is related to 2 bursa. The one above the coracoacromial arch is subdeltoid bursa, because deltoid muscle is above here. Subdeltoid bursa is above the arch. Another bursa is below the coracoacromial arch. Then it is called subacromial bursa. Arterial supply of the scapula. The scapula is a flat bone. A nutrient vessels enter the body and breaks up into branches which ramify all over the bones. The periosteal blood supply is profuse and also important. Arterial anastomosis around the scapula, clinically very important. There are a lot of arteries around the scapula. It is more important for fine points, for advanced learning. This is subclavian artery. It continues down as axillary artery. Subclavian artery will give thyrocervical trunk, which will give transverse cervical artery and also suprascapular artery. Transverse cervical artery will give deep branch coming down along the medial border of the scapula. And here is suprascapular artery, which will come to the supraspinous fossa and also through the spinoclinoid notch enter into the infraspinous fossa. This is axillary artery giving a branch, very important branch, subscapular artery, which is coming down along the lateral border of the scapula. This subscapular artery will give circumflex scapular artery, it goes back. And the branch from here and the branch from here, that is suprascapular artery, and the branch from the transverse cervical artery, all these branches will anastomose around the scapula. So when there is obstruction of these great vessels after thyrocervical trunk and before the subscapular artery, blood can circulate through this route, going around here, anastomose, and finally come back through this artery and enter through the axillary artery and supply the lower part of the upper limb. Ossification of the scapula. Scapula developed from cartilage by endochondral ossification. It arises from 9 ossification centers, 1 primary and 8 secondary centers. The coracoid process and upper 1/3 of the glenoid cavity are developed from the ventral element of the scapula. The other parts of the scapula are developed from the dorsal element of the scapula. Muscles arising from 2 different elements have different nerve supplies. Fine points. Congenital anomaly of the scapula. Sprengle's deformity. Though the scapula is normally located at the upper lateral part of the back between the levels of 2nd and 7th ribs, they developed high up in the neck during intrauterine life. They descend to the normal position. The failure of normal descent gives rise to a congenital high scapula called Sprengle's deformity. Fine points. Gender and site identification. Identifying the gender and site, that is right or left of a bone belongs, is important in forensic medicine. Bones of the male are generally bigger, heavier, and more rough than that of female due to the bigger stature and build of the male and attachments of stronger muscles and ligaments. To identify the site that belong, we must see 3 axes in any paired bones. They are transverse axis, vertical axis, and anteroposterior axis. In each axis, identifying just one end or one side of the axis is good enough. In the scapula, transverse axis, where the glenoid cavity is on the lateral side, anteroposterior axis, the spine of the scapula is directed posterior. Vertical axis, the coracoid process must be above. Rotations of the scapula. The scapula undergoes rotation, upward and downward rotations. If the glenoid cavity, here you can see here, glenoid cavity, moves up, we call upward rotations of the scapula. If the glenoid cavities move down, we call downward rotations of the scapula. What are the muscles acting on this action? Look at the diagram here. In this diagram, you can see this is spine of the scapula. This is the acromion, which is at the lateral end. At the medial end is the tubercle of the spine. You can see here at the lateral end, the fibers attached are upper fibers of the trapezius. At the medial end, the fibers attached are inferior fibers of the trapezius. Though they are the same muscle, one muscle, this is acted by upper fibers, this is by the lower fibers. When they contract, this part will be pulled up and this part will be pulled down. That is upward rotations of the scapula, where the glenoid cavity will move up. In this case, downwards rotation. Here is the glenoid cavity. Here is medial border. The muscles attached to the medial borders are levator scapulae, rhomboid minor, and rhomboid major. When they contract, this part will go up. At the same time, because of gravity, here upper limb is attached there. This weight will pull down the glenoid cavity. So there will be downwards rotations of the scapula. Find points. Scapulothoracic joint. See very carefully the diagram. This is lateral side. This is medial side. This is head of the humerus. This is scapula and its lateral angle, glenoid cavity, which articulates with the head of the humerus to form the shoulder joint. These are vertebral columns at the back. It is attached by a series of ribs forming thoracic cage. Anteriorly, it is attached to the sternum. So if you see very carefully, there is no true bony articulation between the scapula and thoracic cage. Scapula is floating freely, but it can glide up and down, rotates up and down, and protract and retract over the thoracic cage. Because a false physiological joint is formed as opposed to the true anatomical joint between the scapula and the thoracic cage. Now see the muscles in these slides. You can see here, this is pectoralis minor muscle, which will be attached to the coracoid process at one end, and another end will be the thoracic cage. This is scapula. This is medial border of the scapula, anterior surface. This is posterior surface of the medial border of the scapula. Here, anterior surface along the medial border is attached by serratus anterior muscle. Is attached to the thoracic cage anteriorly. Behind here is deep muscles of the back. They are levator scapulae, rhomboid minor, and rhomboid major muscles, which are attached to the posterior surface and medial margins of the scapula and attached to the vertebral column. This diagram is the continuation of the previous diagram. In this diagram, we added the spine of the scapula and the muscles attached to it, that is trapezius muscles, which is attached to the scapula and medially attached to the spines of the vertebral column. This is superficial layer of the back muscle. Although the scapula and thoracic cage are not directly, physically, anatomically attached to each other, there is movement between these two structures, forming an artificial or functional physiological joints between the scapula and thoracic cage here by a group of muscles attached to the scapula. These muscles are called scapular sling muscles. The scapular sling muscles include number 1, trapezius muscles. Number 2, 3, and 4 are deep muscles of the back. They are levator scapulae, rhomboid minor and rhomboid major. Number 5, serratus anterior, which is attached to the medial margin, anterior surface of the medial margins of the scapula, anteriorly attached to the side of the thoracic cage. Number 6 is the pectoralis minor muscles, and number 7 is subclavius muscle. We don't show the diagram here. Although there is no direct contact between the scapula and the thoracic cage, because of this muscle, this group of scapular sling muscles, there is movement between the scapula and the thoracic cage, forming physiological joint, not true anatomical joint, called scapulothoracic joint. The end, illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Now is the good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provide other videos related to the present topic. Thank you for watching.